Hello colleagues, I have no disclosure with these presentations. I start with this picture. So what do you have in mind? Yes, they may fit into the spaces available, but whether it fits into the environment to put those plates. I like also to share this quote, the ones who know about what the doctor does are only himself and God. So this is about discussions on do's and don't in our practice, and including also the reconstructive surgery or reconstructive work beside the ethical concern of aesthetic surgery or aesthetic practice. So aesthetic practice becomes more popular now and more because of the globalizations. Inevitably, there is a chance of a loss in regards to human values. You could discuss it further, but then social media is one of the culprit. Or no, this is not about culprit. Social media is one of the factor to provide influences in our life. So aesthetic surgery is still part of applied science in plastic surgery and also with other core specialties with the branches of aesthetic surgery, be it in ENT, in ophthalmology, or in gynecology. So those practices are in the corridor of medicine. As part of plastic surgery, we are in medicine. So it adheres to bioethical principles that includes autonomy, beneficence, non-maleficence, and also justice. So if you ask whether human natures demand to be beautiful, I would say definitely yes. You started to, uh, to start your day by looking into yourself in the mirror, and then you justify yourself whether you are looking good or not to start your day. And and the questions whether excessive is too excessive in regards to makeup, the personal choice is the answer. So preference. The nature is the fact that everyone goes to perform to be attractive, to be looking more attractive, if it is not looking good or looking handsome or looking beautiful, but attractive is one of the answer. If a patient, see that the wrinkles on the face is actually normal, part of the history of his life or her life, but then at one point she or he asked for botulinum toxin injections to get rid of the wrinkles, this is about personal choice. The nature to perform attractive is not only for women, this is also for gentlemen. So I pick into a case where burn injury is considered to be one of the most disfiguring and distressing injury. So this is a true life-changing injury. If you look into the process on how we help the patients to be looking better, to normalize the way they look, this is about our, our novel, our good deed as doctors. Humanizing the deformed face and debilitating organs is part of our duty. And so if you look into the fact that the patient jumped into social media with all the makeup to provide her looking better and more beautiful, this is about the choice to look good. So back into plastic surgery, well, I think you agree with me that there is no clear dichotomy in between reconstructions and also aesthetic. There is no clear line in between the two. You will see the answer. If you are asked to help babies with cleft lip, do you think that you need to achieve the best aesthetic outcome possible you can do? Now you know the answer again. In regards to gynecomastia as an example, well, this is normal. This is part of the nature where 25% of male with gynecomastia comes with idiopathic. Well, you just you just take it, you just receive it, accept it. Not all the patient would, agree with that. And not all parents also would agree with the fact that this boy, 13 years old, looking like, a woman with the chest, then they bring the boy to come to you asking for a help in aesthetic practice. But then the question is, does reconstructive procedures cross into aesthetic territory? Do you think so? All right, so if I bring you into paraphysiological events, including aging, geriatric people asking for upper blepharoplasty, is it merely about aesthetic surgery? Or there is a need in regards to functional side for the parents, sorry, for the patients. So they demand something that make their life better. And so with this, This is also about the demand. So medical aesthetics and aesthetic surgery at the very basic is to ease psychological problems, not physiological, but to ease psychological burden, to ease or to boost self-confidence. That's the fact, because we deal with normal people to jump into supra-normal. So when you think that you embrace into the practice of aesthetic service, who talks? General revelation is about your conscience. But then if we do our aesthetic service, we are bound into strict standard of professionalism. This is necessary to ensure both ethical practice and, most important, patient's well-being. The patient should have the final authority to decide. If you look back into the principles of ethical principles or ethical conduct, this is about autonomy. So a reflections for every single patient. Am I really making the right decisions as a doctor to fulfill what the patients demand? Well, you can go back into the respect of autonomy, but then again, for the well-being of the patient, you could further elaborate the discussions about this. By doing aesthetic service, do you think that you are still in the corridor to benefit the patients? So this is about beneficence in our practice. Also, the practice would need to embrace into the concept of non-maleficence and justice. So autonomy would allow the patients to self-rule. Self-rule. They have to be free from interference by others. In regards to beneficence, this is about the moral obligations to benefit others. And non-maleficence would include the obligations not to cause harm to others. One ought not to inflict evil or harm. One ought to prevent evil, to remove evil, and one ought to do or promote good. So what about justice? We provide fair and appropriate treatment to all persons, regardless of status or special considerations. This is not only about providing proper medical service that we could provide to the patients in need, but also about the accessibility of our service. So I bring you into a discussions of this case. These patients came from abroad with dehiscence after abdominoplasty. What would you do? There is no circumstances that she will return to the original surgeon for follow-up. She asks you to assume her care. Now, I give you 4 choices of answer. See her in consultation, but recommend that she return to her original surgeon. Even if you are convinced, she will not do so. B. Lie and say you do not know what to do with her problem and suggest she seek help elsewhere because you don't want to take problems. C. Instruct her to go to a local emergency room and possibly the plastic surgeons on call could help. D. Accept her as a patient because you are competent to do so. It is your professional duty to provide care for a patient in need. Which one do you pick? 1, 2, 3, 4, A, B, C, D. Now you get the answer. Option A to C are not in line with the principle of beneficence and justice. Why? Because option A would be highlighted by the fact that therapeutic relationship is clearly disrupted with the previous doctor. Option B and C, we fail to attend the immediate needs of the patients who are in need. And option D fulfills the principle of respect for autonomy and beneficence. So then you could take care of the patients, be it without surgery, to heal the patients from the problems. The second case, just to bring you into discussion, this is not my case. I took it from the reference. A 27-year-old woman came with discomfort of one breast. After 9 months, implant augmentation felt hard rock. Surgery was performed by your partner in your clinic. The patient discloses that she is having consensual sexual relationship with colleague partner. You may be surprised. Your colleague is married. You have had misgivings about his cozy relationship with patients, and you have overheard innuendos made by office staff. So you are concerned that any action against your colleague partner may negatively affect your own practice and reputations. What would you do? I give you choices. A. Speak to your colleague partner privately. If true, you will encourage him to sever the relationship with the patients. B. You will ignore and deny the patient's comment. She has no proof and you do not know. and sorry, you do not want to interfere your problems, to interfere your clinical business, sorry, your clinic business, the business of your clinic. And C, report the allegations to the ethical board of your society. Any choices that fits to your answer, to your thought? All right, so is there any duty to act if doing so is counter to your own self-interest? Yes, I think so. So if A fits your interest but provides little oversight, the behavior would continue and cause harm to the current and future patients. A and B violates the principle of non-maleficence. The use To use the principle of autonomy regarding the consensual sexual relationship may be flawed by the fact that doctors have power imbalance more powerful than the patients. In cases of sexual misconduct, there exists a duty to act. So the allegations warrant an urgent investigation by impartial third parties. So back into the practice in aesthetic, we face identity crisis. There are many more doctors with their own specialties and professionalism, jump into the practice of medical services. And if you see advertisement like this, as an example, world's #1 clinic, and even worse, world #1 doctor. It's about commercialization, pressure from marketing and consumerism, and this impact of beauty standard in social norms, inevitably, and sadly speaking, well, we see the fact in our world. So advertisement entails the risk to employ practices that are false, fraudulent, deceptive, and misleading. Use accurate and respectful language and images are the advice for us to do so. In doing our, introductions to the world that we are plastic surgeons, but then there is also a chance for you to be confronted with the new conceptual changes, with the fact that new technology comes in our practice. E-promotion and marketing strategies by many would also influence your own decisions. So diversity in clinical proficiency and practice are confusing to lay people. Unfortunately, our role has been completely perceived by our role has not been completely perceived. I'm talking to our colleague plastic surgeons, well, we are not really, perceived by primary care physicians. So the source of information and referral is not in our, standard being plastic surgeons, in our existence being plastic surgeons, and mostly by lay people. So plastic surgery services are in competitions to keep engaging with patients to be online. But then the fact that core doctors need to slow down the services of less qualified cosmetic surgeons or cosmetic doctors. This is in line with the principles of non-maleficence, because there should be a body to justify the competency of all doctors doing the aesthetic surgery. So does aesthetic plastic surgery remain where it commences in the medical systems, or is it still intended to seriously benefit patients, or it should cross the commercial world? This is a good question for us to consider, to think. Well, in social media, unfortunately, there is no concrete definition yet to come with, appearance of doctors in social media. So what defined as opposed to be unprofessional needs our, attention to sit down and to provide a thoughtful, product with the best possible regulation that may come. So in doing introductions to people about our existence, there should be a disclaimer about information provided is not a substitute for a consultations. Patients need to understand that. So if we do not, embrace into our professional regulations, and we fail to listen to the fact that history has told us, then a professional have failed to self-regulate, then others would jump to regulate us. So I think the doctor has only one room ethically in promoting our works in social media, that is through soft selling, which is merely through education. Education should be ethical. On the other hand, doctors, aesthetic practitioners are in the chance to be innovative, to be resilient, facing the world, which changes very fast. We continuously evolve social media with the fact that changes are very immense. I show you the video just to make sure that doctors need to be innovative in their practice, This would include also the future influence of AI, rhinoplasty counseling, facelift counseling, everything would be replaced by social media. Even we as doctor would still take our role. So there are chances for us to understand that we may lose our skills in consultations. This is in constant change where the world embraces the fact that AI is everywhere in our life. So de-skilling practitioners would be the negative effect of AI in the future. But then we have to understand there are also places for us to embrace the AI, get along with the patients, that both of parties have to go into the correct way in using AI. And in doing plastic surgery services, in aesthetic services, we also make contributions to the applied science. And so we avoid falsification and fabrications. And so, of course, with the plagiarism. So because this is very easy for you to get AI to jump into FFP. So patient surgeons awareness are together, work together with the core of science and research. When we do together, we carefully navigate ethical terrain related to the AI. Harness use the benefit of AI responsibly and minimizes the potential drawback. We preserve the integrity of patient care and trust in healthcare system. This is our goal by embracing our life with AI exist in our life. Ethics also relates to law. Just give you a brief, a brief stimulating uh, discussion that this patient may be easily to be recognized, the same patients after facelift, but these patients and many more jumps into very significant changes, whether the work would be still in line with the law. So all in all, ethical frameworks in our practice to ensure ethical practice in both aesthetic and also beyond aesthetic, including reconstructive field of our work. Ongoing education for both doctors, surgeons, and patients is our duty. And also we need to improve ethical standard and accessibility to all patients in it. I would end this presentation by inviting you to our Congress in Scar Medicine, November in Bali, 7 to 9 November this year. And also I invite you to join, if you're a plastic surgeon, join ISAPS. And we have Olympiad in Singapore, June next year. Thank you very much for your kind attention.